DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, Dr. Dan here from DocTalk. Thanks for joining us today. Our guest will be Dr. Mike Sanderson, who's a professor of epidemiology and beef cattle production. We're going to talk about a disease that continues to surface to the top as being issues in beef and dairy herds and potentially at the food chain, Jonies. Jonies disease in beef cattle. Thanks for joining us. More after the break.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com. Mike, welcome to the show.
Thanks for having me.
Folks, this is Dr. Mike Sanderson, who's a professor here in the Department of Diagnostic Medicine and Pathobiology at Kansas State University, where he is a professor of epidemiology and beef cattle production medicine. And Mike, we're here to talk about Jonies, and you've done some research on Jonies in the past, or at least done some survey work with Jonies, and you've seen some herds with Jonies as well as a practitioner. Let's just get into what is Jonies and kind of talk us through what it does.
Yeah, I think it is an important disease, Dan, and it's caused by a bacterium with a long name. It's Mycobacterium avium paratuberculosis, but for short we call it MAP. And that causes Jonies disease. And in cattle, it causes a chronic diarrhea in adult animals that the animals appear to be still healthy, except that they lose weight, they have very fluid diarrhea, and eventually then go downhill until they die or they're culled out of the herd. One of the interesting things about it is, though, that the calves are who is at risk and who gets infected. Almost always they're infected when they're less than a year of age, but they don't show any signs until they're 3 to 4 years of age.
Cool. So this is something that is a chronic illness. It's not something that's a real acute, but it's not going to show up clinically until generally after they've had their first calf. The heifers have had their first calf, or when they reach that 3 to 4 years of age.
Right, that's true.
So with the long name, and that, what are of MAP? Thanks for shortening that up for us. But let's talk a little bit about just kind of is it a highly infectious agent? Is it when do calves become infected with it?
Yeah, so the younger the calf, the higher the risk.
Okay.
So when they're very first born is when the risk is the highest, and it is fairly infectious. So at that early stage of life, they're highly at risk, and that's also right around calving. We've got, in dairy herds, the calving area is very important, and the calf can get inoculated right then if we're not careful. In beef herds, clean udders and that sort of thing are very important to prevent transmission. So yeah, it's fairly easily transmitted, and especially when they're quite young in life.
Okay, and then the disease in mature animals when they get it is extremely debilitating.
Absolutely. They will just really go downhill and get very, very thin, eventually die if you don't cull them.
And so we'll start to see the diarrhea in those animals, in those more mature animals, followed by extreme weight loss because they just don't digest the nutrients.
Right, their gut just gets completely, it gets very thickened, and it just doesn't digest anything very well anymore, so everything pretty much just runs straight through, comes out the back like a garden hose.
Yeah, and actually they have that sewer pipe gut, and they can't digest. We're going to take a break. When we come back, we're going to jump into some of the herd level problems, or some of the herd level issues that we see with Jonies disease, and what it can do reproductively, what it can do production-wise. This is Dr. Mike Sanderson. I'm Dr. Dan Thompson. Thanks for watching DocTalk from Kansas State University. More right after the break.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Ashley Zondlak grew up working on her neighbor's dairy operation, and at 16, it became her full-time job. Over the years, she has shown cattle at local fairs, volunteered at Breakfast on the Farm events, and during vet school, she worked in Michigan State University's mastitis lab. After graduation, Ashley's goal is to work as a food animal practitioner.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer, Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Mike Sanderson, who is a professor of epidemiology and beef production in the Department of Diagnostic Medicine and Pathobiology at Kansas State University's College of Veterinary Medicine, where Dr. Sanderson does research, he does outreach, he does teaching, many different hats that he wears. Tickled to death to have you here. Talk about Jonies and kind of on a herd level what we're looking at.
Jonies definitely is a herd level disease. There isn't any treatment or cure for individual animals, and so it's much best managed at the herd level. So if we want to, we want to control the risk that we'd introduce it to the herd, and then if it is in the herd, we want to control and eventually eradicate it. One of the first things maybe to think about is how common is it? And so if we look at surveys that are done in beef herds, it looks like about 8% or 8 out of 100 beef herds probably have Jonies in the herd. If you go to dairies, it's probably close to 2 out of 3.
Wow.
About 68% is the estimate for dairy herds. So it's fairly common in dairies, not so common in beef, but in both cases it can be fairly debilitating. For dairy herds that have a high level of Jonies in the herd, may cost something on the order of $200 a cow per year in lost milk, in decreased reproductive rates, and those sort of things. In beef herds, it's probably lower, but it still does cause some economic impact in terms of decreased milk production and then decreased weaning weights and those sort of things.
Sure, it's got to have an impact on the calf crop when the cow's not able to you know, digest the nutrients the way that she's supposed to, and then partition the energy towards lactation. You know, when we start to look at some of these in beef and dairy and the herd level, you know, is there a difference then in the way that we approach these? I mean, I'm gonna make the assumption that the dairy industry is more attuned to testing and looking for this disease than what we are in the beef industry.
They are, and probably appropriately so, since they have more. In either case, I think it's a disease that you really want to talk to your veterinarian and make a detailed plan about how you're going to deal with it. Because you can waste a lot of money doing things that don't really work all that well. So any testing plan and eradication plan needs to be very well thought out, or it'll just spend money and not achieve your goals.
And there is a national Jonies program, correct?
There's a national voluntary Jonies eradication program, yes.
Voluntary?
Yes, it's voluntary in that you don't have to be involved. There is no federal support in terms of money for it. There was for a while, and then tight budget times brought that to an end. So there's no federal support, but there is some guidance in what's a good way to approach eradicating it.
Okay. Well, we'll get into that after a bit. But when we come back, let's talk. We're going to talk more about prevention of how we prevent it from coming into the herd, and then we'll talk in the last segment about how to eradicate it.
Great.
Folks, thanks for watching DocTalk. More with Dr. Mike Sanderson from Kansas State University right here after these messages. Thanks for watching DocTalk. See you in a minute.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Folks, welcome back to Doc Talk. Dr. Dan Thompson and Dr. Mike Sanderson from Kansas State University's College of Veterinary Medicine, where Dr. Sanderson is a professor of epidemiology and beef production. And we're talking about Jonies disease, and we're going to jump into prevention because that's really the key for any disease or any injury is let's prevent them from happening. So what is the key to preventing Jonies from entering my herd?
I think the most important thing, Dan, if you can, this is actually difficult, but is to import from herds that are negative. Of course, you have to have some basis for why you think that herd's negative, and probably the best is that the herd you're importing from is involved in that voluntary eradication program. So if they are, then they have tested their herd, and you have some assurance that there's not Jonies in that herd. That is by far the most effective way to keep from importing it into your herd. So if seed stock producers, you'd like them to have tested their herds. Dairy replacement heifers, if at all possible, you'd like those to have originated from a test negative herd.
Absolutely. So I think it could increase value for people that are looking for value adds in their bull sales or
Absolutely.
Value adds in their replacement heifer sales is getting that eradication or that Jonies free status on your herd, or at least the test status
right.
on your herd.
Yes.
And with a lot of other diseases, we talk about if you buy an animal, to quarantine and test it or quarantine it doesn't necessarily work for Jonies.
Now, because of some things about Jonies disease and how the disease acts, the test is not very good at identifying individuals that are infected. It's pretty good at the herd level, identifying herds, but not individuals. So testing animals as you bring them into the herd and even quarantining them is not very effective at preventing it from being in the herd. And quarantine because they may not break with the disease in a way that you could see for 2 or 3 years.
Because it's an intermittent shedding, intermittent disease.
Right, and then they're only clinical when they're 3 or 4 years old.
Yeah, and so I think it's just as important to know things that don't work as it is to know
right.
the things that do, because you can go through a lot of time, money, and effort in quarantining for Jonies, and it's
right.
not going to make any difference.
No, it won't help.
The other biosecurity tool that people talk about a lot is vaccination.
Right.
And so you said there is a vaccine?
There is a vaccine for Jonies, but because it's a similar bug to the bug that causes TB in cattle, this is not a risk for humans in terms of tuberculosis, but it's similar, and so the vaccine will interfere with TB testing. So you have to have permission from your state animal health officer to be able to do the Jonies vaccine. It's probably helpful, at least in some cases, in really high herds that have a very high number of positive cows. But generally we don't use it much.
So it'd be more of a tool that we would utilize in eradication than probably what we would use in like vaccinating cows on arrival. It's not something we can just go buy off the shelf.
No, and only in severely affected herds would you consider using it.
Cool. Well, let's take a break. When we come back from the break, we'll talk about eradicating it once we get it in the herd. And we'll talk about test and removal and different things that we can do to eradicate Jonies. You're watching Doc Talk. Thanks for joining us. More after these messages with Dr. Mike Sanderson from Kansas State University's College of Veterinary Medicine.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vet Medica, Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA Tip of the Day, we're going to talk about bunk space management as well as pen densities. In this sort of scenario, one size doesn't fit all, and we must always remember that. One of the most critical time frames of pen density and bunk space management is when we're starting high-risk cattle. We want to give those cattle as much room as we can. The general rule of thumb I use is if we're starting high-risk cattle, every animal must be able to come to the bunk at the same time. If you're looking at those cattle and feed them in the morning and not every single high-risk animal can come to the bunk at the same time, we need more bunk space. May not necessarily do anything positive for the economics initially, but on the back end in terms of economics, it will pay on the front end to give them 18 inches of bunk space. We want to give them that bunk space to reduce stress, let them get good feed intake. Also give them a good amount of space in the pen. That's our tip for today. Thank you.
It must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it has been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to DocTalk. Dr. Dan Thompson and Dr. Mike Sanderson, and we are from Kansas State University's College of Veterinary Medicine. Dr. Sanderson is a professor here of epidemiology and beef production, and has a lot of experience as a beef practitioner, a lot of work in the dairy and beef industries as an epidemiologist and diagnostician and beef production medicine expert, and we're talking about Jonies today. And so what happens once I get it in the herd?
Well, once you get it in the herd, it's actually a long-term plan to try and get rid of it. It's not easy, but it can be done. And the most important things are to prevent transmission to those young calves. So if you're in a dairy, you want to remove calves from the cow as soon as you can after they calve. You don't want to allow suckling or any more contact in that calving environment than you have to for those calves. Get them away, and then keep them segregated from the adult cow herd, and that includes any feces from the adult cow herd. We want to make sure that we don't get some feces that contaminates feed. We don't want to feed colostrum that is not from negative cows. So we'd like to test cows, cull positives, and then keep those calves separate.
And I think that the one thing that people need to understand too is that it is a fecal-oral transmission. This is a bug that's in the feces, so if it's, keeping the environment clean, especially in your beef cow herd, keeping the cows and calves in drier areas if possible. I mean, it's common sense for all etiologies of diarrhea, but when you're really focused on Jonies, you got to keep those udders clean. And
absolutely. So that cat for the beef herd, obviously we can't remove calves from cows, but we do want a very clean environment for calving. Clean udders are really important, and as soon as you can, getting those cows and calves dispersed so that they're not in an environment where the calves have much contact with manure. That's really important, and will not only be valuable for Jonies and decreasing transmission, but also in every other enteric disease, calf diarrhea. That's just great for calf diarrhea. So you get paid multiple ways.
Yep, I think people don't understand either that you can track it on your boots.
Absolutely.
You can have, if you go move manure with the loader bucket and then go grab a bale of hay with the fork, or and just the cross-contamination, understanding keeping feces away from the baby calves
really important.
as much as you can.
And this bug and most of the other diarrhea bugs of calves can live for a long time in the environment. This MAP bug, 9 to 18 months, depending on what sort of where it is. So you have to maintain that for a long time.
Work with your veterinarian?
Absolutely. So that's going to be the greatest source of some technical information that you need to make sure you get it done right.
Cool. Well, thanks for joining us today on the show.
Thanks. Enjoyed it.
Folks, that's Dr. Mike Sanderson from Kansas State University's College of Veterinary Medicine. If you want to know more about what Dr. Sanderson and I do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. Thanks for joining us today on DocTalk. We appreciate you tuning in and learning more about Jonies disease, how to prevent it, how to eradicate it once it does get on your farm. I'm Dr. Dan Thompson. Thanks for watching DocTalk, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.